All right. Well, I couldn't pass this story up. So we're going to start with this first because I've read a lot about the correlation of good gut biome and just general good health. So when an article came out that correlated how often you poop with how healthy your mouth was, well, I had to dig in a little bit deeper. So I think it's important to understand those with chronic constipation and those with chronic diarrhea might not have the best oral health. Those of you watching tonight or the next couple of days that poop somewhere between 7 to 8 times a week, well, you might just be at operating efficiency for good gut biome as well as good oral health. This was backed by 7,512 adults that they surveyed and studied with their bowel habits and their oral health screens, looking for different disease processes that might be correlated with poor oral health. Those who had chronic constipation, gosh, 45% greater odds of poor teeth. Those of you with chronic diarrhea, 24% increase in poor teeth. So I think the correlation here, the takeaway message is obviously there might be some connection. It's the thing that dentists have been screaming for years. The oral cavity is not just a separate entity that you take on vacation, it is connected to systemic health. When the gut biome is happy, the oral cavity is happy, and vice versa. When the oral cavity is happy, gut biome is happy. In fact, as best I understand, that is one continuous track from start to finish. So it might behoove us all to focus a little bit more on making sure that both ends of the track are operating at full proficiency. We're seeing a lot more uptick in dental loss ratio. That's been a big hot topic since 2023 when Massachusetts question 2 came up. But many states are also taking that mantra and bringing it up for additional voting. In fact, North Dakota is now the most recent state to pass a dental loss ratio of 75%. Now, what does that mean for our viewers? Just to refresh you, dental loss ratio means that when an insurance company is collecting premiums, 75% of that value needs to be directly reapplied back to care. Anything beyond that would be administrative costs, et cetera. That falls in the North Dakota case in the 25% bucket. If they don't hit that measure, they owe money back to their subscribers. Of course, that doesn't mean increased reimbursement back to providers, but at least there's renewed focus on making sure that when we're collecting premiums, that is going directly back to the patient in some form of education and services. So right now we have 23 different states that either have introduced legislation, passed legislation, or have upcoming legislation for review. That's certainly a pretty big uptick from the 2 states we saw back in 2023. So this has become a pretty hot topic for a lot of legislatures and a lot of state legislatures to look at making sure that dental premiums are at the benefit of the patient. Another interesting study that came out of the Economic Outlook and Emerging Issues. This is an ADA quarterly poll they've been doing since the pandemic and with the HPI, looking at different statistics amongst our profession to see how we're performing, to look at what the impact of the pandemic has had. But what has evolved is really just looking at the dental industry as a whole. One interesting survey that came out recently from this particular collection of data was the 10 different measures that they surveyed, or 11. How many of those different measures are offices still implementing today? So, for instance, if your team is still wearing N95 masks, face shields, disinfecting multiple surfaces throughout the office, not just your normal routine cleaning and within the infected areas of your operatories, pre-screening for COVID symptoms prior to showing up at the office, air purifiers, different types of other physical protection mechanisms, checking staff members' temperatures. The question was, how much of that is still in place today? And actually, nearly 94% of dentists cited that they're still doing some or all of these different measures that started back in 2020. I thought that was super interesting. especially because I'm not sure if I'm doing any of them. I mean, we just went back to business as usual. Judge me if you will. That's fine. But I always thought dentistry was actually at the forefront of managing infectious disease long before COVID came. We were all wearing masks, we were all doing protection, we were all disinfecting those operatories routinely, managing aerosols with our high volume suctions, et cetera. Like, I really thought we were doing a lot of things really great already. Some of the pre screening stuff wasn't on board yet, but we implemented that quite quickly. But it looks like a lot of these parameters are here to stay, or at least for the next little bit. So we'll continue to monitor that and see how that evolves. The last story for tonight is a bit of an economic discussion. We're going to get you kind of like the first story from the beginning to the end. Now, an interesting study, well, correlation of data came out not that long ago of the top dental schools in the US. Now, I think there was a lot of debate about that, but personally, as a graduate of UNC Chapel Hill, I was happy to see that it was number one. I think it stirred a bit of debate amongst many of us within the profession wanting to know the criteria, and I get it. But again, if you're the graduate of the institution that earned that banner, you're just not going to fight it too hard. But the interesting thing about this next story is, okay, let's take the top 10 schools as identified by this particular study coming out of bestdentalschools.org. Not really sure that's a real thing, but we're going to go with that for a minute. What's the cost to go to one of the best dental schools in the US according to this particular ranking system? Well, if University of Chapel Hill is number one, and I would debate that it is, total in-state tuition for your 4 years of dental school, not including cost of living, is $153,000. A non-resident tuition is $291,000. This ebbed and flowed somewhere between $150,000 to $200,000 for in-state tuition versus somewhere between at the low end 157 for out of state at Texas A&M. Good job, Chad, and your Texas fellows, all the way up to 454,000 as a non-resident tuition from the University of Missouri Kansas City School of Dentistry. So all over the board. But general consensus is it is roughly right now $150,000 at minimum to go to dental school, and could be as high with non-resident tuition at the top 10 of right at $500,000. Now, why is this important? How much do we make once we get out? Well, the interesting story on the flip side of this is, where are the top 10 cities to earn an income as a dentist once you graduate? The US average salary for a dentist right now is around $196,000 a year. But if you happen to go to the Coast, Oregon, non-metropolitan area of the US, you can earn yourself $279,000 on average, all the way down to our great city of Columbia, South Carolina, not that far from our dear Jeff Horowitz, at $250,330. Now, what I did learn from this particular story is not one of the three hosts that host this show every week lives in one of the cities that earns the highest income potential for a dentist. In fact, I don't know many. I might know two dentists from any of these areas. That might be food for thought. Now, could you possibly process the idea that the most earned income for dentists might come from areas with either the least saturation of those professions in that area or a lower density of population? You could also correlate with that. Is that where dentists want to live, or are they going home? Lots to digest in this particular story. Just depressing enough to know that none of us happen to live in any of the cities where dentists are earning a real income. And with that, that's the news.